always come at 10 p.m. Eastern Time every Saturday. I would love to hear your questions about anything related to the family, as God designed the family to be the small church in everyone's house. Your children should grow to become the fruits in the garden of our Lord's church. Family Matters deal with issues regarding your own family, between husbands and wives, between parents and children, and challenges that meet and facing our kids. One of the topics that I felt very hot these days is the Delta virus. And I must say the amount of discussions, amount of curbside questions that people ask warranted a live show like today. And I hope we can make other shows like this with other experts in order for us to be aware, well educated, and well informed. There are plenty of misinformation. There are plenty of facts and even more myth than facts. So I want to start by giving you some facts. So the first thing I want to say that COVID-19, when it started, we knew that there are so many variants. The first one, which about a year ago now, was the Alpha one. And they used Greek letters to indicate 5 other important variants: Alpha, Beta, Gamma, Delta, and those are the most common for now. However, there are 27 other variants that they are being followed. The differences are in the genomic arrangement of the virus, that what happened is the sequencing of the genetic material may change. Every virus, since the creation of the world, tend to change its shape or form. And what happened is, with time elapsed, the virus becomes a different variant. It's still COVID, but a different variant based on some genetic changes. Now, if we had massive vaccination and over 75% at least of the world was vaccinated, the number of variants that are going to happen would have been far less. Unfortunately, because we are only less than half of the world, maybe actually 30% of the world vaccinated, the chances of variants and other variants coming up, unfortunately, is going to happen. In December 2020, B1617.2, or the Delta variant of COVID, was discovered in India. It was very rampant, was very, very tough. Lots of Indians, unfortunately, died. And unfortunately started to be detected in 43 other countries since December. In late June and definitely mid-July, the United States and CDC announced that's now a variant that is being considered very highly as a cause of 90% of the current infections in America. If you take Australia, which had been on lockdown for, I think, 8 weeks, they started complete lockdown on Friday because of a massive increase in the numbers of Delta viral infected people. Several deaths occurred from Friday up till today, and I have been following their news. They are complete hard lockdown. Whole Sydney and several other cities. Now, unfortunately, only 20% of the Australians are vaccinated, and hence the prevalence of infection now, unfortunately, among our brothers and sisters in Australia. Same can be said about United Kingdom. America has in a slightly better shape. We're about 56% vaccinated, around that figure, at least one vaccination. Now, because of that, there is still an increase in Delta viral infection in the States, especially Southeast and the area of California, Atlanta, Florida, Texas. These were the worst cities, and because of that, actually, now there is a lot of regulations coming back from CDC and from other regulatory companies or corporations to tell us what to do. I'm not coming here to scare you, however. I want to say a couple of facts and receive your questions. I hope they come. The first fact, this virus actually is not a very virulent, aggressive virus, but very contagious, spread like worse than common cold, worse than influenza, similar to chickenpox, very contagious, spreads very, very fast. Actually, Delta virus is spreading faster than the Alpha or the mother one, COVID-19. However, among vaccinated people, very few are getting infected by Delta virus, regardless of the vaccination. Actually, I have the data that people who are vaccinated with Pfizer or Moderna are over close to 90% protected. Only 10% from vaccinated from Moderna and Pfizer are getting the Delta virus. Now, if I say 10 to 20% get reinfected, strangely, those who were vaccinated before, actually, when they are infected, they do not get a bad infection, and very rarely they get admitted to the hospital. So, one of the questions that just came, why Coptic Orthodox Church say anything about the vaccine not being safe for human beings? Thank you for your question. I kind of not sure why they say it's not safe. There are 46 million vaccinated, and many of these people actually are the ones who are not being infected today. People who are not vaccinated, unfortunately, are the ones who are filling the hospitals today. And those are not lies. I know you claim I'm lying, but believe me, I am speaking out of truth as a physician, and I have my moral etiquette to speak like this. I can tell you in the hospitals that I attend, we went from 10 to 12 patients admitted to over 20 to 30 per day. I can tell you 90% of those are unvaccinated. Now, you can actually claim whatever you like. You can decide you don't want to be vaccinated. That's your call. But should you do that, I ask you please to keep your mask on. At least you do not infect other people who wishes to stay and later on hopefully never get infected. Now, I want to give you some other facts. So as of July 22nd, 80% of those who were tested positive for COVID-19 had the Delta variant. According to CDC, again, the last week of July, which last week, Delta variant accounted for more than 80% of new cases in the US. And unfortunately, we expect that the numbers will continue this way. Now, the symptoms. Now, the symptoms are very interesting. We used to get loss of smell, severe headache, fever, loss of taste. Strangely, the Delta virus have only flu-like symptoms. And all what we are saying, it's a variation of the viral presentation or manifestation, but it's much milder form in the beginning, but unfortunately in non-vaccinated people, it can result in worse outcomes. So if you are vaccinated, you may get mild flu-like symptoms, almost like a common cold, and then usually it goes away. There are nothing you can do different than what you have done to COVID-19. There is no real prevention, if you may, except the vaccine. So the vaccine, even if some of you may disagree, it's the only sure method to reduce infection. And if you want to ask, and I got that question, which vaccine, whatever vaccine you are able to get is the best vaccine. So if you are, for example, in a country where only the Chinese vaccine is available, great. If you are only the AstraZeneca, great. If you only have J&J, that's fine, and so on. There are certain groups of people, and I got some question about a person who may have issues with clotting mechanism. So in women, especially younger ones, and especially those who have issues with clotting or tend to be on contraceptive pills, we ask them to avoid vaccines that caused some what we call superior sagittal sinus thrombosis, or really thrombus in the brain, which was correlated with one of the vaccines. But apart from that, all the vaccines are equivalent in their effectiveness. Some variations, of course. As you know, Moderna and Pfizer are messenger RNA, so this is the nucleic material. This is not an attenuated or a vector of the virus like the Chinese or AstraZeneca. So we think, and I have that question that came from one of the mothers, in pregnant women and breastfeeding, we like them to be vaccinated because in pregnancy, the virus is a lot worse and results in premature delivery. And a lot of moms who were in their third trimester who were unvaccinated, unfortunately, when they got infected, they were quite hurt by the virus. So the recommendation both by the Royal College of Obstetrics and Gynecology from United Kingdom, the American College of Obstetrics and Gynecology, both recommend very highly to take the vaccine, the two, Moderna or Pfizer, before the third trimester. Some doctors recommend that you take the first dose after the 12 weeks of pregnancy. And those are still being followed with no side effects. Now, I can tell you all the obstetricians are recommending them, to my knowledge, of course, but you have to ask your own obstetrician that you take the vaccine. In breastfeeding, because Moderna and Pfizer, both of them are nucleic acids and messenger RNA, they are not, and they should not change the genetic material. Feeding. There is a study came from Scotland, several thousands of women. They actually studied the breast milk and no clear side effects were published. We use common sense. We use wisdom of many of those professors who study these things. And then we balance things. Which is worse, the virus or the vaccine? And I don't think anyone who has studied and really balanced in his or her opinion would say, I would rather take the virus rather than worry about 0.002% of side effects. So now, one of the things that I would like to also hear from you, if you have any concerns regarding masks. Now, this is very interesting because we went for about 4 months starting to lose the masks, feeling better about it. CDC just came to start saying that we ought to put the masks back. Now, especially in California, they mandated the masks, I think, the fourth week of July. So it's already 2 weeks using masks because of the very high number of Delta variant infection. Now, I think it's safer to say any indoors, especially with people you have not met before, and especially when they are close to each other, masks are mandatory. I am very concerned because we lost the social distancing. We are not keeping it anymore. Second, we are relaxed a lot. And now we are getting a Delta virus, and I'm hearing that another variant also is maybe coming in the autumn because some countries already showed some increased numbers. I believe that the use of masks should be considered, at least for any indoor type of meetings, whether church or types of any gatherings, whether it's in school. Now, regarding the schools, it's very important that our children above 12 and above to be vaccinated. We do not have any data to support vaccinating less than 12 yet, although I believe Moderna is working on it. Now, 12 to 16, of course, every parent has the right to refuse, but the data is showing that the variant is very rampant among young people, and it's spreading mainly it's going to be in the schools once opened in September. So I urge parents, or at least I recommend that parents consider vaccinating their children before the year starts. Now, one of the things I would like to bring your attention to is in some communities with lower vaccination rates, like what happened in Sydney, for example, Egypt, um, many of, of the states that still have a 20-30% vaccination rate. Those rural areas with limited access to care, Delta variant could be even more damaging. What was seen around the world with countries who have very little access to vaccination gives us an indication that we need to be much more vigilant about vaccinating our families. Now, I hate to be the bearer of bad news, but COVID is not going anywhere anytime soon. This is a way of life that we need to be adapted to. Unfortunately, the virus will keep modifying itself because the virus is, as much as it's very simple, it's very smart. And the only way to really go about it is to really be smart about vaccination. So another question that came, why did we rush in taking the masks off? Unfortunately, people were so happy that the virus went down a lot and we were in the 1.4% in New York. Now we're getting into higher, at least in New York. So, and with the rate of vaccination, and we enjoyed a good time, and I'm not saying it was wrong to take it off, but I think with the rapid rise in this vaccination, in this one, we need to be careful. So, agent. I can't understand this question, but the second part of the question I understand. Scientists and doctors are saying it will change a human being's DNA. Thank you for the question. I can't say plural by scientists and doctors because I represent at least one of, of these two categories. And I can tell you thousands and thousands of scientists and doctors do not actually agree that the DNA will change. Those who have placed these theories in many of the YouTubes do not have any factual studies to prove or disprove what happened. Now, all what I can say that it was a thought, but especially with messenger RNA, which is an amazing method of making a vaccination to the extent in oncology, the discipline that I subscribe to, it's now being thought to be one of the amazing methods to deliver some of the new therapies against cancer. So messenger RNA should not affect DNA because it does not enter the nucleus of the body. Another question that came regarding the breastfeeding, I just mentioned it, but I'll say it again since it seems it's an important question. Again, we do not have a long-term or a solid data to prove safety. However, both the British and American obstetricians are advising that women who are breastfeeding to continue breastfeeding even when they are vaccinated. Women who are planning to get pregnant, they should go ahead and get vaccination because vaccination does not affect their fertility. Women who are pregnant can continue to take the vaccine because there is no harmful effect that they saw or they know of as far as the vaccination. For those who are very scared, I wish they had the chance to even visit a pregnant woman who is on a ventilator and suffering from COVID, and the baby dies because of premature birth. And then they start making all this rumors against the vaccine and how the vaccine is not going to help and it's hurting and it's damaging. I think we need to be careful in really spreading myth rather than facts. We do not have any facts to support danger of the vaccination, but we have a lot of facts to say people who are unvaccinated are the ones who are falling now and coming back to the hospitals and raising our numbers, using the resources. You can't imagine how many hospitals now are start to be ready to move beds and to move nurses to ICUs, apparently waiting for the other shoe to drop. This is 90% of those patients are the unvaccinated ones. So I urge you, please consider. I can only recommend, I can only tell you what I know and what I read and what I'm honestly speaking about, but of course I cannot make you do what you don't want to do. There is a question that came regarding could other variants happen? It's a very interesting question. And as I said, I was reading an article that there are several other variants. They call them variant in evolution or in interest, something like that, which means it didn't reach to the level of infectivity yet. So we are concerned when that the Delta came, there may be Lambda will come or Beta will come, we don't know. At this point, the more the number of vaccinated people, the lesser the chance for the virus to modify itself and become a different variant. Another question that came asking about the COVID testing, very, very important question. So there is no specific testing for the Delta virus. You cannot just go to a lab or a pharmacy and say, I want Delta virus testing. You can ask for COVID testing. Generally speaking, most people still think that COVID testing will show Delta virus even as a variant. However, though, the researchers to actually make sure you have COVID, they do something called genomic sequencing. This is a very sophisticated test. I actually don't understand as much as I should. So basically, because of that, we think that we continue to do COVID testing. There is one small article is warning that COVID testing may miss Delta virus. However, at this point, we don't have any better things to do except to continue testing. I received a question regarding a person who is taking Humira. Should you take the vaccine or not? So generally speaking, and speaking to rheumatologists and allergists and immunologists when we had the prior forum, people who are taking immune therapy, immune modulating therapy, chemotherapy, they must check with their own doctor. There are a lot of other factors that need to be checked, not simply a general question that I could answer in a forum like this. I personally would ask your rheumatologist who is giving you the Humira. More than likely he will say, yes, take the vaccine. But I would not be the one recommending it. Do vaccines have different efficacy against new variants? Thank you very much for this question. And this question came more than once. So it's very interesting. They found that let me just get it exactly so I don't make a mistake, that Pfizer had 96, sorry, one second. Yes, in a peer-reviewed journal shows that Pfizer vaccine is 88% effective against Delta variant and 96% effective against hospitalization from Delta after 2 doses. Came from a public health England analysis and also Yale Medicine. The AstraZeneca from Oxford, which is also, it's not a messenger RNA, is 60% effective against the Delta variant, but the more important thing is 93% effective against hospitalization, according to the doctors from Yale. So, knowing this, the vaccine still protects against the variants, thankfully. There is a 10%, 10-15% possibility that even vaccinated people get infected. But even when they get infected, they are not the ones getting hospitalized, and they are not the ones getting severe infection. So the vaccine still works, even though the virus is becoming more intelligent. How does the Delta virus spread? Unfortunately, Delta virus spread like any other virus, like common cold. It spreads actually worse than common cold. It goes from the sneeze and the cough and actually goes to become droplets that goes to the other person. And that's why even if you are vaccinated, you like to put the mask on just in case if you're carrying the Delta, you don't transmit it to an unvaccinated or the reverse. Does Delta has different symptoms than COVID-19? Yes. Delta has flu-like symptoms. You do not get the smell issue and the loss of taste that COVID has. You do not get the severe temperature and the cough and the severe headache. However, you may get headache, you may get runny nose, you may get sore throat, fatigue. Those are the most common flu symptoms. So if you do have what we generally call cold or flu-like symptoms, I urge you to be tested and put the mask on until you know if you are positive or not. One of the other things that also comes to mind is the idea about, I would like to quote one of the Yale pediatric infectious disease specialists. His name is Dr. Inchi Yildirim. He says, cough and loss of smell are less common. Headaches, sore throat, runny nose, and fever are much more common among recent surveys in the United Kingdom, where more than 90% of cases are due to the Delta strain. So the Delta strain may not cause what we got used to back in March 2020, when everybody lost smell and lost taste and became in bed because of severe temperature. But you will get something like sore throat, runny nose, maybe a little headache, and things like that. Okay. Another area that I need to bring to your attention, 97% of hospitalized, and that's what worries us. We are not worried, we are worried of course, but we are more worried about people who get to the hospital. Because the burden on the hospital, the resources of the hospital are right away being used, and then a patient who comes in with a heart attack may not be attended to because the ICU is being filled with people who are hospitalized for COVID. 97% in one study came from UC Davis Medical Center in California. 97% of hospitalized COVID-19 were unvaccinated. Can you imagine? I mean, I thought it's only 80%, but in UC Davis was 97% of people who are hospitalized for COVID were unvaccinated as of July 22nd, 2021. So their recommendation or their conclusion, vaccines are highly effective at preventing COVID-19 infection and also effective in fighting against Delta infection. Okay. Now, when I come to California, because they are fighting very fiercely, and I know doctors and nurses there, may God bless them, they are working very, very hard to contain the infection. Health experts there are really very worried that it's going to show their third wave in California this coming month. Um, Now, there is something called breakthrough infection. And I want you to learn that term because sometimes you may go to the doctor or you want to hear something, you want to speak clearly about it. Breakthrough infection meaning when you are vaccinated and you get infected. I am asking you to be careful, but I don't want you to be too concerned. If you are vaccinated, live your life normal, put your mask when you are indoor, and avoid people who are sick. Just regular wisdom, common sense. However, 10% of those people, according to UC Davis, far less, 10% will get infected and only 3% will be hospitalized to the hospital because of bad infection. So for those who are vaccinated, do not lose your life over it. The idea of vaccination is we get back to normalcy as soon as possible. That's why the churches are open and hopefully the schools will continue to be open and the gym is open, and we hope that all of this continue to be open, but it can only be opened if higher and higher numbers become vaccinated, and then the virus becomes like polio. When I go back to 70 years ago, when polio was rampant in the world and the polio vaccine became available, unfortunately or fortunately for that time, there was no much politics, and medicine and physicians were more trusted, and polio vaccine really eradicated polio. You don't see paralyzed kids anymore thanks to the polio vaccine. Unfortunately today, because we are making so many theories and many of us sometimes come up with ideas without facts, we are making confusion to many people, and unfortunately that leads to the wave that we are in now. So does the Delta attack the lungs? I really don't know the answer to that. I promise I'll look into it. I haven't seen it, but those who get admitted to the hospital, they eventually succumb with lung problems. But so far, Delta infection is the symptoms I mentioned, but if they were to get to the hospital, then unfortunately it will be similar after all, because it will be droplets in the lung. I'm trying to see if there are any questions I missed. So okay, until I get the next question, so I just want to use this sentence from Yale Medicine stating, as of July 22nd, there were 65,000 breakthrough cases, which means people who were vaccinated before, among 160 million who are fully vaccinated. Those who play with our minds and try to make us doubt what we need to do, they need to look again at these numbers. Out of 160 million vaccinated, there is 65,000 who had breakthrough infection. Now, 0.04% of vaccinated people basically have breakthrough infection. 0.04%. And then out of those, only 3% will be, like 3% out of these numbers will be actually admitted to the hospital. So if you find a vaccinated person in the hospital, that will be one of rare cases. So again, 90%, close to 90% effectiveness of the vaccine. All ranges of ages. Of course, both immune compromised, elderly, pregnant, breastfeeding, all of them are allowed or should take it. Are we going to have another dose from the vaccine to cover this variant and other variant? Very good question. And I'll tell you what the CDC just announced yesterday. They announced that they are going to give a booster shot to immune compromised individuals in order to extend their immunity longer. I predict, this is just an educated guess, that they will start giving a third booster of Pfizer by the beginning of 2022. Probably they will start the same way. Elderly, immune compromised, then physicians, nurses, therapists, technicians, and then go to the rest of the people. Again, I think this whole topic would have not been a topic if 95% of the citizens were vaccinated. The virus is only smart because we were not. The virus is only able to modify itself because we did not modify our behavior and allowed science to give us what we can only protect ourselves with. I was so pleased with Australia and Sydney, and they were almost COVID, they called themselves zero COVID for several months because of almost quarantine of the whole country for several months, out maybe one of the very few countries in the whole world, until unfortunately a major breakthrough happened. And now I believe this is their 9th week of lockdown, and now it's a hard lockdown. No one can leave because even if you go out, they are very worried about people getting infected or infecting each other. Now, some experts are recommending the masks, and even if you are fully vaccinated, I urge you to consider masking in indoor places. Again, the reason is you don't know who is unvaccinated. And of course, it's very unwise to keep asking. Second, you don't want to carry the infection to the unvaccinated who may not be able to take the vaccine for any reason. I received a question regarding the COVID vaccine. Would it be needed to be taken annually? There is a discussion among scientific fora regarding something like we all take some booster vaccine every year for many things. Like physicians, every 10 years, they take, not physicians, everybody take tetanus shot every 10 years, and they take a booster shot when they fall or they hurt themselves in the street. Unfortunately, COVID is going to stay and is going to modify itself. And I believe that the annual or semi-annual or some sort of a booster shot will be offered on regular basis, but I'm not sure what a regular means. So a question, if anyone has pulmonary embolism from 7 years ago, can you still take the vaccine or will it affect you? Thank you for the question. So pulmonary embolism, for those who do not know the word, means blood clots in the lungs. Number one, you had the embolism 7 years ago, so I'm not concerned about you. Your embolism have gone, you are cured from it, you are living normal, I'm sure your breathing is normal. You must get the vaccine. You are one of the people, although your lungs are functioning better, but the reason you got the embolism is the reason you should get the vaccine. Because what made you get the lung embolism could have been something in your clotting mechanism. The only thing I wouldn't do is I would rather take messenger RNA, not the vector. So either Pfizer or Moderna. There is also another question is regarding people who have eczema, arthritis, and skin allergy. There are no reason at all for those people not to take the vaccine. It's similar to any other vaccine. Only if you have a vaccine allergy, then you must speak to your allergist, immunologist, rheumatologist, hematologist before you take the vaccine. But if this is just uh, simple eczema, skin allergy, um, and I have people who had psoriasis, rheumatoid arthritis, systemic lupus, liver diseases, and all of these people gotten the vaccine 9 months ago, and they are all fine without any side effects. Speaking of anecdote complications, every one of us may have heard of one case that probably 1 out of 3 or 4 millions that you hear one case of, for example, nerve issue or a heart issue. No one for 100% sure can correlate it with the vaccine. And the good thing is, if it is correlated to the vaccine, which is possible, that doesn't mean it will stay. I know for sure a person who I have been following for a nerve sort of weakness called facial palsy after the vaccine, and he completely recovered. If someone got infected with the virus, how long they have to wait to get the vaccine after recovery? So the minimum is 30 days, the maximum is 90 days. We do not know which number you should do. Personally, I say after 2 months you should get the vaccine. Um, yeah. So what can happen to a person who get the vaccination and they found out they had COVID? Will the vaccine be effective? That's actually a problem that physicians are having today, that you go and get the vaccine and later on same night you start complaining of sore throat, many things that are unrelated to the vaccine. You get tested and you are positive. We don't know what to do with this. The only thing I know that we will not give you the second dose in a month. We will give you the second dose in 3 months. Those are the people more likely will need the booster than any other person, unless they have very high antibodies. And speaking of antibodies, by the way, I was told by a very high level infectious disease specialist that please do not worry about testing your antibodies after the vaccine, because the current antibodies assays or survey or test is not geared toward the Pfizer vaccine. Um, yes, I mean, somebody is almost saying the same thing, that they will not stop until the whole world is vaccinated, and the booster vaccine at that time may not be needed. I agree with that sentence. Um, I am I'm not here to try to give you any lies or myth or misinformation. I am just speaking out of morals and ethics of what I'm seeing in my community and in my hospital. It's much easier to get a vaccine rather than to wait and hopefully not get infected. I think the gamble is a game that many infected people will tell you, I wish I didn't. I wish I did have the vaccine. I wish I didn't listen to my friends and refuse the vaccine. Unfortunately, it's very easy when you are not having an infection to think that you will never have the infection. Unfortunately, the odds are against you, because many people who are infected today actually thought exactly like you. Question. If you have the antibodies, would you consider protected as you are vaccinated? You are protected for the number of months the antibodies are high. There are some studies that well published both in India and in America showed the antibodies from COVID can stay up till 6 months. So for these 6 months, you probably are covered. And that's why people who are with high level of antibodies, when they get the vaccine, sometimes their side effects of the vaccine are higher. They get more pain, they get more fever, they get more headache, they get a lot of symptoms because they have a lot of antibodies. So the interaction between the vaccine and antibodies are, the fight is it's tough. However, you still need the vaccine because what are you going to do after the antibodies faded? And how do you know that antibodies are still there? You can't get tested every day. So there will be a time that you lose the antibodies. And when you do, you will not know if you lost them because you didn't do the test. So the best is to get vaccinated. Um, do you think school will be virtual? So I don't know. I am hoping not. Our children are depressed, anxious, gaining weight, having poor eyesight because they are using the computer all the time. Their neck hurts because they are humped down like this. They are gaining weight because they are eating and sitting down and not moving. They lost social skills because they don't meet friends and teachers. They don't go out, so their moms are fighting with them all the time and they are fighting with their children. I'm praying to God that the schools do not close. I can tell you for the sake and sanity of our family that matters, I wish that schools will be opened. If you are a parent, please consider vaccinating your children 12 and up. That's your call though. I cannot make you do anything. You can study, you can read, but should you agree with the data, go ahead and do it because at least you can send your child to the school without feeling so scared. So somebody said, how can we trust the vaccine? It's still an experiment and we don't know the side effects in the long term. I am not disagreeing with you actually. You are absolutely correct. But let's take the other side of your question. You don't want to take the vaccine because of potential possible late side effects. What is your alternative? You are going to have possible infection, and when you get, God forbid, the infection, you cannot predict if you are going to be, if this infection could be, God forbid, fatal or not. Go and talk to families who lost their husbands or brothers or sons or daughters because of COVID, and come back and ask yourself, is the gamble worth it or not? So, should we trust? Do we know the long term? I don't have the long term. But let me ask you, when the polio vaccine came, when the measles vaccine came and you gave it to your children without thinking, when you gave the mumps vaccine, when you gave the diphtheria vaccine, and there is no diphtheria in the world, we don't study it, we don't know it, it's written in very old books. How come we trusted all these vaccines? Because the infection is worse than the thought of a side effect. All these vaccines continue to work and continue to protect humankind, and humankind is thankful to all the scientists have done their best to make us safe, make our children healthy, prevent polio from the world. God forbid, I was reading about an athlete in Arkansas that he was one of the mountain climbers. He got COVID and stayed in the hospital for a month in Arkansas. When he came out, thankfully, after almost a miracle, he has a 25% capacity of his lung. He hardly can move around. He is not going to climb a mountain anymore. What about 1 year to 11-year kids? Good question. Unfortunately, we don't have an answer because the study is being done. Remember, America is one of the most rigorous countries of the whole world about testing, especially pregnant and pregnant women and children. We do not rush in giving anyone any type of medication in these two categories until it's very, very, very well tested. And that's why 1 to 11 years, the study is being being performed as we speak. And I predict by the end of the year we should know. And I think it's going to be safe. I already heard from many pediatricians that they would like their children to participate in the study in order for them to get the vaccine. Question. Public transportation is getting crowded lately. Is it going to be safe for students to commute in full packed bus or train? How can we protect them? Um, Good question, and I really don't know how to answer except use the mask, vaccinate if they are 12 and up, and that's it. If they can bike, let them bike. If they have to take the train or bus, let them take the train or bus. I am sure many of the large cities like Los Angeles, um, some places in Texas, they are going to actually mandate the if there will be reduced number of transportation. I actually have 20 cities across the states today. They have very high level of Delta virus. I'm going to name them: Charlton, Georgia; Newton, Texas; Pemiscot, Missouri; McDonald, Missouri; Grundy, Tennessee; Ziepag, South Dakota; Hempstead, Arkansas; Ripley, Missouri; Lanier, Georgia; Motley, Texas; Baker, Florida; Telfair, Georgia; Hurd, Georgia; Holmes, Florida; Washington, Florida; Carter, Missouri; Jeff Davis, Georgia; Texas, Missouri; Triloton, Georgia; Bacon, Georgia. According to this list, those cities are some of the highest in the country as far as Delta. Whether, and very possible, they will make the schools virtual, I really don't know. I'm praying and hoping that it doesn't, for the sanity of our families again. But for all the crowdness, I can tell you the mask work, the vaccine work, and have a little trust in the system. I know there is so much myth and so much propaganda that tells us otherwise. I wish those people can make a round in an ICU and see how much nurses sometimes cry because they don't know what to do for a young man or a woman who's in ventilator and they don't have enough help to help him. There are certain places in the countries now the nurses are so thinned out because they are working several shifts and they can't cope with it. We don't want to go what we were. I wish we heed the advice and we go about it and we continue to be good citizens because we want to help each other. Somebody asked if I got COVID in May 2021. Does it mean I got the Delta? If not, that means I can get the COVID again. 90% you got Delta. Um, in May 2021, we have start to increase the Delta across the world. I started from India, as I said, and traveled all over the world, United Kingdom, Sydney, and then several places in the world. New York wasn't, States wasn't as one of the earliest ones to start catching it in end of May and June. So can you get any COVID again? Any one of us can get any COVID variant. Delta, Gamma, Kappa, I don't know. But again, maybe in a month or 2 months from now, if you are not vaccinated, please go ahead and get vaccinated. I urge you to consider it, and you will be 90% covered from most variants. Unless the virus became so smart and changed completely that the vaccine is not effective, then I don't know what to do then. But today, the vaccine is close to 90% effective in the variants that it's in the world today. So trust in it, read about it, read from scientific papers, New England Journal of Medicine, read some scientific papers. Do not just don't listen to me. I want you to go and be educated. But do not just listen to YouTubes, because some of us who are speaking like me may be biased. Fine, do not take my word. Please go and read scientific papers. Speak to your own doctors. Many of these doctors have seen horrors and they want to protect you. I thank you very much for your questions. I thank you for attending today. I am hoping and planning to arrange an open forum with several experts once I see where the Delta wave is heading. I ask you to please um, do not lose hope, always smile. In spite of the anxiety we are fearing, I want you to have faith, have hope, because I am sure there's plenty of great things going to happen. Until we meet again on another Saturday live session with Family Matters.